We acknowledge that the land on which we live and gather is the appropriated homeland of the first people of Seattle, the Coast Salish peoples. We express our deepest respect to these people, past and present, for their care of this land throughout the generations. Let us learn more about and honor the history, culture, and traditions of the Coast Salish peoples and all Indigenous peoples. My name is Evelyn Strawn, and I'm a member of the League of Women Voters of Seattle, King County. The League of Women Voters has been around for over 105 years. We are a nonpartisan, nonprofit membership organization. We do not support any political parties, and we do not support any candidates or persons in office. Our mission is to empower voters and defend democracy. We empower voters through candidate and education forums such as this one, voter registration, get out the vote events, civics education, and observing of King County elections. And we defend democracy through our advocacy work, which is based on long developed and held league positions. We welcome everyone 16 years of age and older to join us. You can find out more about the league on our website, which is lwvskc.org. We're very excited this evening to be co-hosting this forum with the Seattle Times, and we thank the King County Council candidates for their participation tonight. Please consider this an introduction to the candidates and their specific views on mental health, and continue to learn more about the candidates between now and the election. I now want to introduce our moderator, Taylor Blatchford, who is an engagement reporter for the Seattle Times Mental Health Project, where she reports on mental health and helps the team build connections with community members. She was previously a member of the Times investigative and digital teams. Her work has been recognized by investigative reporters and editors, the Society for Features Journalism, and the Washington Coalition for Open Government. Once again, welcome, and now I'll turn this over to Taylor. Thank you.
Hi, everyone, and welcome. I am Taylor Blatchford, and I'm glad to be here as your moderator for tonight's forum. So I am going to ask a number of questions in the next hour, many of which were inspired by questions from our Seattle Times readers. Each candidate will have 2 minutes to answer each question, and you'll be able to see how much time you have remaining thanks to our timekeeper from the League of Women Voters, who will have that on the screen. We will alternate the speaking order for each question. And for those in the audience, you can submit your questions using Zoom's Q&A function, and we've saved time to include some of those at the end. We will begin the forum with 2-minute opening statements from each candidate, and Councilmember Balducci, you can go ahead and start us off. Thanks.
Well, thank you so much. Thank you, League of Women Voters. Thank you, the Seattle Times. Thanks for everybody who joined tonight. This is a very important race. My name's Claudia Balducci, and I'm one of your 2 candidates tonight who's running to be King County executive after 16 years under the prior executive. So it's a time of change and real transition for our county. At the same time as we're having a change in leadership, we're seeing very big challenges that we're going to talk about tonight, especially in the areas of healthcare and mental and behavioral health. It is a time when we are being faced with slashed budgets from the main sources of funding for these critically needed services at a time of dramatically increased need. I come to this race as someone who has run a major county department that had a big role when we fail to provide mental and behavioral health care. It falls into the emergency system where I have a lot of experience. I am a former mayor and city council member of the city of Bellevue, where I've run the second largest city in the county. And I am currently a council member representing a large part of King County. As county executive, we're candidates, we're always asked, what are your top priorities? And the top priorities we've been talking about and hearing about a lot include housing and homelessness, public safety, and transportation. But I am very glad that we are also going to talk about mental and behavioral health. I'm a mom of a kid who spent fully half of middle school in their bedroom, mostly alone due to COVID and COVID lockdowns. Our young people And many, many of our neighbors are experiencing mental health challenges and even mental health crises and behavioral health crises. And it is incumbent on the next county executive that we, despite shortages, come up with solutions that will help people to stabilize and thrive. And that is what I hope to do as your next county executive. Thank you.
Thank you. And Councilmember Zahalai, you can go ahead and share your opening statement.
Thank you to the League of Women Voters, the Seattle Times Mental Health Project for bringing us together to talk about this really important issue. Thank you also to the Balmer Group for funding the Mental Health Project and all of our listeners today for leaning in on such a critical topic. I'm Gurmai Zahalai. I'm the chair of the King County Council. I'm running for county executive because I believe that this region can be a place of safety and care and opportunity for everyone who calls it home. And I know what this region can be because I know what it was for me and my family. When we came here as refugees when I was 3 years old, King County opened a lot of doors for us and gave us a lot of investments, affordable housing, good public schools, social safety nets, jobs, Medicare, healthcare. All those things allowed me to go from low income public housing in South Seattle, like Rainier Vista and New Holly, to graduating from college and law school and working in anti-poverty space, and then serving as chair of the King County Council that I now serve in. I am the candidate in this race that has the track record, the vision, and the relationships to deliver for the people of King County. And we've done so as my time on the council shows. Our work championing the Crisis Care Centers initiative, for one example, has led to generational investment in our region's behavioral health system. My goal as the next King County executive is to continue collaborating across the public sector, the private sector, our labor unions, our service providers, our impacted communities, to continue those investments because they've never been more important than they are right now. We're going to be facing, in addition to our own local level issues of an astronomical cost of living, a massive shortage of affordable housing, now we're going to be experiencing the compounding effects of devastating cuts from the federal government. And those absolutely will impact our health care, our mental health care, our substance use disorder care, and so much more. We have to work together to solve these problems. Thank you.
Thank you both. Our first question is about some of those federal changes that we've seen this year. So, the majority of people who need behavioral health help in King County obtain insurance through Medicaid. With the federal government imposing stringent new work and reporting requirements on Medicaid, how would you ensure that King County residents can obtain care and therapy that they need in a timely manner? And Gurmai, you can go first.
Thank you so much, Taylor. Yeah, this is a really concerning issue, and I've been gathering a bunch of healthcare experts to really highlight what the impacts will be at the local level, because I think when people see the top line numbers of the cuts that are coming down from the federal government, it's hard to get a grasp of what the impacts will be. You know, the CEO of Harborview told us it'll be much like it was during the pandemic, with people in Harborview being treated in the hallways, emergency rooms overflowing. People who work at Western State Hospital told us already the time it takes you to get health care from a place like Western State, the average wait time is 5 months in the midst of your crisis. And now that timeline is going to be stretched out even more. People who work in long-term care were telling us that a lot of people are going to lose their medical equipment and the things they need to survive. So we absolutely need to prepare for this. I would propose that we collaborate much more effectively with the state government to make sure that we're getting the resources that we need and closing any lack of collaboration. We need to strengthen our funding sources. We have tools like Harborview Tax, the Mid Tax, VSHSL. We need to make sure that those resources are nimble and able to be invested in the areas that are being disinvested from by the federal government. We need to streamline our licensing and regulation requirements to make sure that providers can expand faster. We need to strengthen our continuum of care. We know that we have a patchwork system in our region, and the more we can close the gaps and make sure that a person who's getting care in one part of the system can go on to the next part of the system, to the next part of the system until they've made a full recovery. And that kind of coordination takes people getting in the same room, collaborating with each other, knowing each other's names, knowing the specific conditions that each of our clients are going through, and making sure that we're collaborating until that person makes a full recovery.
Thank you. I think that there's a number of things that we need to immediately lean into. I don't want to give up on the possibility that we might be able to make some change at the federal government and avert at least some of the cuts that are coming down. And to do that, we obviously need to work across the aisle. These proposed cuts are going to hurt red states right along with blue states. And we have ways to work with our colleagues across the country and make common cause to try to have influence with the federal government. I wouldn't hold out a lot of hope, but we have to try. And as somebody who has worked in a part of the county that has got both red and blue elements, I've worked very effectively across the aisle with Republican partners and been able to move big things because we were able to put aside differences and focus on the needs of the community. We have a little bit of time to prepare for what's coming. The cuts are not scheduled to take place until the end of 2026. At the county council, we just voted to extend our mental illness and drug dependency sales tax levy, and we did not vote on a commensurate plan for spending that money. We do intend to keep using it for what we've been using it for until we can come up with a new plan. We might have to make the hard decision to reprioritize our funding from things that are preventative to things that are responding to crisis, not without cost. When you stop doing prevention, you guarantee more crises in the future, but we may have to just deal with people who are in crisis and help stop human suffering and provide for support. One of the reasons that King County is looking at a disproportionate cut in Medicaid is because we disproportionately signed people up during Obamacare or Medicaid expansion. We can use the same tools we use to do that, investing in navigators, for example, to help people stop, like not trip over the new requirements and keep enrolled. There's lots of tools we have, and we're going to need to bring them all to bear.
Thank you both. A recent audit of King County's Department of Community and Human Services found that the department failed to properly oversee the grant money that it was sending out, resulting in unapproved payments and possible fraud. As King County executive, how would you address these audit results and ensure greater accountability in this department's spending? And Claudia, you can go first on this one.
Thank you for the question. Yeah, this audit was kind of shocking. We've had a pretty good track record at King County, with a few key exceptions, though, of being responsible with our funding. The voters are very generous with voted levies to support people in need in King County. The very first thing the next executive needs to do is finish the audit. This audit looked at something like 33 to 36 contracts and found a lot of problems in this bucket of contracts. We have almost 600 contracts in this kind of services. We don't know the scope of the problem. We need to know the scope of the problem to appropriately scale up solutions. When the audit came out, I was very concerned. I think most of us, if not all of us, were. And so I leaned into action right away. And I was very proud to be praised by the Seattle Times editorial board for doing so, for being the candidate in this race who leaned into action. And we're taking steps right now. We need to fund more fiscal oversight into the future. We built up these programs without building up the fiscal supports that were needed to make sure that contracts and contractors are being supported and that we're having the accountability that we need. We don't do our contract partners, our nonprofits, we don't do our community any favors when we don't provide the kind of fiscal support and accountability to help them to succeed. Not only does money get wasted and potentially stolen, we also are not meeting the needs of the community and having the outcomes we want to have. The next executive is going to have to highly prioritize accountability. I'm going to propose that we consider having a charter amendment to have an audit function in the executive branch, which we don't have today, to separate it from the politics. so that it is not sitting right next to the person who is most at risk of getting a bad headline when things go wrong, and we give them the independence and authority to keep us on the right track.
Thanks. Gurmai, you can go ahead with the question about the audit.
Thank you, Taylor. The results of that audit were unacceptable. When taxpayers give King County their money, they expect that we're going to protect it and that money is going toward solving problems that they care about. We need to honor that commitment, and that was not honored with respect to the contracts that were audited in this case. And so I absolutely support the recommendations that came out of that audit report, things like doing more site visits and giving some of our community-based organizations more training around capacity and financial accountability. And I want us to take it a step further. I was proud to support Councilmember Dunn's legislation to expand accountability, and I even added my own amendments. But long before this audit came forward, my team and I released a plan exclusively dedicated to government accountability, efficiency, and transparency. That plan is called King County Delivers. It's on my website if anybody wants to check it out, electgurmai.com/priorities. And that came out months before that this audit report came out, because accountability would be a central theme of my administration. My plan calls for things like an office of internal audit within the executive's office to make sure that we're not waiting for a council member to request an audit, but that we're proactively auditing every single department, not just DCHS, to make sure that money is being used the way it's supposed to be used. It also calls for quarterly reports. The same way that a company releases quarterly reports as a form of accountability to its shareholders, King County should release quarterly reports as a form of accountability to our taxpayers, to say, this is how much money we collected from you. Not only these are the programs that we started, but this was the outcome from the money that you spent, because we want to make sure that we measure our success not based on programs started or money spent, but then on the outcomes that are produced. That is accountability.
Thank you both. The Capitol Hill Crisis Care Center location, approved by the County Council this week, has generated some neighborhood pushback and some concern about the location. As executive, how would you ensure that this center and others in the future maintain positive relationships with the community so it can fulfill its mission? And Gurmai, you can go first on this one.
I think it's important to start with talking about the problem that the crisis care centers are trying to solve. Several years ago, during the pandemic, when we saw mental health issues and substance use disorders exploding and so many people visibly suffering, I started to ask, why is this happening? And I went around and found out that all the places that we would usually provide care for people are over capacity and stretched thin. And when it comes to finding actual clinics that provide urgent behavioral health care, King County had only one for the entire region of 2.3 million people. And so I initiated the conversation around, we need to run a behavioral health levy. And I worked with the executive and our business community and our labor community, and we put forward the Crisis Care Centers initiative. And now we have to do the really hard work of siting these facilities, 5 facilities around the county. I would want to make sure that, first of all, we deliver on what we promised the voters, 5 centers, 1 youth focused, and we have to do a much better job of engaging the community early and engaging the community authentically. The feedback that I've gotten from the Capitol Hill community is that that kind of engagement did not happen as effectively as it could, and I would be committed to making sure that that happens in the future. But most importantly, nobody disputes that it's a good thing what happens within the walls of a crisis care center. The pushback that we're getting is, how do people come in and how do people go out? And that has been my focus, is making sure that we invest in the outreach professionals to actually get people to come to the center. So this is a net positive for the neighborhood, and making sure we have a really strong post-discharge stabilization plan so that people can get to where they need to go to continue their recovery journey, because we know we can't just push people back out into the street after a crisis. There needs to be more a connection to permanent supportive housing. There needs to be a connection to maybe long-term residential mental health bed facilities. Whatever people need, we need to help them get there. And that is part of our commitment and our accountability to that neighborhood and to the community suffering.
Thank you. Should I dive right in? Okay. Um, yeah, I too, along with all of our colleagues on the county council, strongly supported Executive Constantine's initiative to create crisis care centers. I have also, as an executive myself, worked to cite difficult to cite but very necessary infrastructure. It's one of the hardest things to do. As the mayor of Bellevue, I partnered sub-regionally over here in East King County to create the first ever homeless shelters and permanent supportive housing in all of East King County. And it is predictable that every time you try to find a location for this very, very necessary infrastructure, people around the area will have concerns, and these are legitimate concerns. Uh, the reason I know about the Capitol Hill neighborhood's concerns is because they invited me to come see the concerns, and I went. I've met with them multiple times. I went up there late at night one night and walked around and saw what Capitol Hill is like at night. And there's a specific challenge in neighborhoods like Capitol Hill, like Pioneer Square, where our county offices are, where there's a concentration of activity, of services, of street challenges. In Capitol Hill, it's nightlife, but also drug addiction, violence. We're hearing about shootings and stabbings. And so having this crisis care ability is something that could benefit the community, but they're afraid that there won't be help when there are problems. And so it is once again the overlap of mental health care, providing what the community needs, but also being sensitive to the community's challenges around law enforcement and what's going on the streets. We can work to make this better, but the next executive has to take something from concept through funding and political approval into implementation. That means showing up in advance. That means hearing people out and trusting the community and working with them on siting. Another challenge with this particular site is the financing and the size of the building are like not what we would normally see. So we have an opportunity now with an oversized building to provide more services the community might actually benefit from and appreciate. Thank you.
Thank you. King County has put significant funds and effort into expanding mental health crisis services beyond just these centers, including services like mobile crisis units and diverting mental health calls from 911 to 988. What do you think is working in the crisis system as a whole, and what would you like to see improved? And Claudia, you are first up on this one.
Thank you so much for that question. Yeah, King County's been a leader and really has been leaning into trying to find ways to increase access to mental health care, and particularly for people in crisis. One thing I'm very proud of that the county has done, uh, some years ago, when you talk about mobile crisis response, we had 7 different providers, all doing different versions of mobile crisis response. It's not very efficient. It means that people have to know where to call, who do I want, how do I access? It makes it harder for people to access care. And so we, and when I say we, I do mean we, I didn't do this, the county did this, coordinated and created one central hub for mobile crisis care, for mobile crisis response. And now we're funding it through things like our various levies. That's a success story. That's that better access, more service, more efficient service. And we are going to have to make the most of our dollars as the amount of funding decreases. We're going to need to get absolutely the most out of it. I'm proud that we are starting to invest in workforce training. That is possibly the biggest challenge to providing enough mental health and behavioral health care is not having enough workforce. We've got some money in our levies to do that, but the pipeline is dry all the way down into like high school. We need to start investing in education and diversification. I've had some conversations with one particular counselor who really made an impact on me. She's a woman of color. She said that there are specific cultural needs that she knows about as a professional and as a person with that cultural experience. And she's just burning out, trying to serve all the people in need that really would benefit from her expertise. We have to get more workforce and make sure that we are spreading it out. I think we'll talk about youth mental health care. Huge challenge with youth mental health care, having enough providers to respond to the surge in need among our young people. Thank you.
Yeah, should I just dive straight in every time, Taylor? Okay, sorry about that. I'll give 2 examples of things that are going well. You know, we all saw the ballooning and exploding overdose deaths that happened during the pandemic, and that was horrifying. The human toll was unacceptable. And what we've seen from King County Public Health and all of the other people who are part of the system is that the ubiquity and prevalence of overdose reversal medications and medications to treat opioid use disorder have really been life-saving. And you have seen tapering off or a falling off of the rate of those deaths, at least compared to the peak. And so the ubiquity and the innovation and the technology for delivering the medicine have all been success stories. I would also say that our drug courts are success story. I always hear really amazing testimonials from people who've been through that system, who are back on their feet, and who um, didn't have a criminal justice system just kind of be punitive towards them, but actually helped lift them up. And I would count that as a success as well. What I think needs to get better is coordination across all the system, across all of the different people who have a role in this system. I held a town hall a few weeks ago called Breaking the Cycle, and it brought together the people from our jails, the people from our healthcare systems, the people from permanent supportive housing. And they talked about how people fall through the cracks. You know, if we incarcerate somebody who has been going through an addiction and they're in our custody in the jails, are they just discharged without a next step plan and the lack of coordination within the whole system? And so continuing to strengthening those connections and making sure we have a strong, coordinated continuum of care across the whole region so nobody falls through the cracks would be a top priority for me as executive.
Thank you both. I want to remind our audience members too that if they have questions that are being sparked by these discussions, they can submit those in the Q&A, and we will take some of those at the end of our forum. Our next question, in your view, what can the county be doing better to support patients once they come out of involuntary mental health treatment in the civil commitment system? What kinds of services can the county provide to ensure people are continuing to get that mental health, housing, and medical support? And Gurmai, you are first up on this one.
Thank you. Yeah, I think involuntary treatment should be a last resort and never the default. But when somebody is in crisis, they absolutely need this to be a functioning part of the system. And based on the testimonials that I hear from either people who have been in crisis or their loved ones who are trying to get them care when that individual is a threat to themselves or to others, they have a really hard time accessing this system. And there is a lot of dysfunction within it. And so fixing the involuntary care system would be a top priority for me. You know, we need to stabilize our criminal justice system, understanding that public defenders and courts are an integral part of the system to honor people's due process rights. And so that would be really important. I was proud to prime sponsor legislation to be able to backfill the kind of scale of cuts that were going to come down to our criminal justice system. So stabilizing that is number one, coordinating better with the state to make sure that when we open hospitals like the one at the UW, that there is coordination with the county, which has a big role in designated people for involuntary care and taking them through that criminal justice system. But we understand also, like you mentioned, Taylor, that when people leave the system, they need that continuum of care. They cannot just be discharged the way I talked about people being discharged from our jail. And so the first thing that I would do is convene all of the people who are part of this system, the people who have a role in permanent supportive housing and job training and substance use disorder care and mental health care, our drug court system, everybody, and really strengthen those ties so that the person leaving involuntary care is not just left without a plan, but there is a roadmap for them based on their individual needs, and they are assigned a case manager who can take them, hold their hand through that whole process until they are back on their feet, from crisis to recovery to job training to affordable housing and permanent supportive housing, the full spectrum.
Can I ask you to repeat the question, please?
Yes, absolutely. In your view, what can the county be doing better to support patients once they come out of involuntary treatment? And what kind of services can the county provide to ensure people are continuing to get mental health, housing, and medical support?
I muted myself. Thank you for repeating the question. So Involuntary treatment is a big challenge, and it needs to be used judiciously. I want to give a shout out to our medical health professionals who are tasked with, and this is a King County function, tasked with evaluating people for involuntary treatment. It is one of the hardest jobs. They're called on for a lot, to do a lot, and it's very complex work. And people's freedoms and their rights are at stake. So we're trying to balance in involuntary treatment care and people's rights to make their own decisions for themselves, regardless of whether those are decisions we would make for ourselves. Whenever anybody leaves a system of involuntary confinement, be it jail or involuntary commitment for mental health reasons, that is a revolving door. That is what we talk about when we talk about the revolving door, somebody coming in crisis and then going back out. We need to make sure that we have people on both ends of the equation, making the right decisions on who comes in, using the resources judiciously and fairly, and then making assessments and connecting people to care on the way out. One example of a place where we could do much better is medical record sharing, making sure that a person who comes into one of our crisis care systems doesn't lose contact with the benefits and the services they do have. This happens all too often, and then people have to reapply, or they don't have, or they get given a supply of medication for a certain number of days with the expectation they will reconnect themselves to care. And this can be really difficult for somebody who's going through a very difficult time by its nature. So having that navigation, casework, people to get and information sharing so that people have a seamless experience of being cared for, especially at the times of crisis and when there's a moment to intervene and help to stabilize.
Thank you both. Our next question was submitted by one of our Seattle Times readers ahead of this event. Not every person in our society has the capabilities to live independently. Please state your views on supportive housing for those with mental health issues. And if you're in favor of supportive housing, what strategies would you use to increase the current capacity? And Claudia, you can start us off.
Yeah, thank you for the question. We're known in this region for pioneering the concept of permanent supportive housing, and it is now a proven best practice for helping people to stay healthy and stable in housing when they have ongoing needs for mental health care, for physical health care. Many people in permanent supportive housing just have chronic diseases that need care and they're unable to care for themselves. So a big part, one of the major legs of the stool of stabilizing our people. I absolutely support it. I was proud to be a supporter of the Health Through Housing initiative, which was King County's big push to increase permanent supportive housing. I have been a leader in my part of the county in implementing the first ever permanent supportive housing, and that was not a county project. It was just a project that we had to find a site for and get approvals and buy-in and funding for, plus the Health Through Housing. So we need more of this, and we need it to go where people are. So the siting challenge is real, but the more we show that permanent supportive housing can work and people who live in supportive housing are our neighbors, they are people who live in our communities, they are, just like the person down the street from me who now has somebody come in to help her care for herself as she ages and needs help. Like this, it's not a scary thing. The permanent supportive housing providers are challenged right now and they need our help, and they will need the next county executive's help. The level of acuity, the seriousness of conditions for people in homelessness, in shelters, in permanent supportive housing, in different places has gone up and up and up. And so folks are being brought into settings that are not set up to provide the level of care. And this has caused some real challenges in some of our permanent supportive housing and other kinds of subsidized housing. We need to make sure that we have the acuity levels for people, and there's a gap of that. So I would support higher acuity housing with more services so that every level it can be successful and all the people can be successful in it.
Thank you so much for the question. Permanent supportive housing is absolutely a best practice, and we need more of it. One of King County's most effective initiatives is the Health Through Housing initiative, which was a sales tax that allowed us to buy up hotels and motels during the pandemic when those were distressed assets and we got them on sale. and we were providing permanent supportive housing to people who need it most, people who are chronically unhoused and have those compounding, overlapping issues of mental health disorders, substance use disorders. And earlier this year, we were able to see some really positive results from the program. Because of permanent supportive housing, we saw that people were visiting the emergency room less frequently. And when they were in the emergency room, they were staying there not as long as they usually would. And so signs like that show us that permanent supportive housing is good, especially for people who don't just need a roof over their head. They need a lot of other types of help as well. So what should we do? I think we should continue to expanding the public funding toward permanent supportive housing, whether that's through health through housing tax or MID or VSHSL and so much more. We need to make sure that we identify publicly available land so we can cite it. And what I propose is having a county land bank that we collaborate with other cities and states and other municipalities to find underutilized properties that we can cite those in. We need to make it easier to cite. That means partnering up with local municipalities much earlier, with the local community much earlier, so that we can cite these facilities. We know that is always one of the biggest challenge once you already have the resources that are needed. And especially during this time when we're losing so much funding, making sure that we're training up the workforce and preparing them to operate those facilities and giving them the support they need and using our dollars more efficiently has never been more important.
Thank you both. Sustaining and supporting the mental health workforce has been a persistent challenge, and one that both of you have alluded to in your answers. Jobs in community mental health, in particular, often don't pay enough to keep up with King County's high cost of living. How would you work to bring more people into the community mental health workforce and ensure that they don't burn out? Gurmai, you can go ahead.
Yeah, when I was working on the Crisis Care Centers initiative, one of the top questions that we would get from community members is, you're going to open up all these buildings and who's going to operate them? Because they understood that due to the pandemic and many other factors, the mental health, behavioral health workforce was strained and burned out and seeing record vacancies in that sector. And so what we did is make sure that we're proposing a third of the resources to go toward workforce development, stuff like recruiting, retaining, training. All of that is a part of the Crisis Care Centers initiative. But we know that we're talking about something bigger than just crisis care centers. We need to do work across the board because we're seeing vacancies and staffing issues and retention issues in a lot of different areas. So first and foremost, I would want to make sure that we're fixing the licensing bottleneck and make it easier to be accredited to be in this field. You have to partner. I would partner with the governor's office, clear application backlogs, and make sure that we're removing barriers for people to become qualified. I also think that we need to invest more in training. That means partnering up with our unions, investing in apprenticeship programs, investing in crisis training academies. That's all a really big part of it. We need to pay better. I was proud to support the minimum wage increase and be the prime sponsor and champion of that for people who are operating in unincorporated King County. My mom was in the a nursing practitioner and making minimum wage. And so I know that it's really important to pay people better, especially commensurate with the complexity and scale of the work that they are doing. And nobody works harder than people in this field. I would want to make sure we're partnering with unions like SEIU 1199 to uphold labor standards and invest more in that workforce in that way. So a lot of work that we can do to support our workers, recruit them, retain them, and that's what I would do as executive.
Thank you for the question. We're running for office. We're candidates on the campaign trail, and we've spent a lot of time looking at these problems, looking at solutions, and the list of solutions can be fairly obvious. Like government has worked on workforce initiatives in the past in areas where we needed focus. When aerospace was looking at a workforce crisis, we pulled together a regional effort that focused on the ways in which government, private sector partners can all increase investment in people getting the degrees, helping with scholarships, helping with building up programs that can quickly train people. Like there are tools for doing that. We're facing a dramatic lack of resources and the resources going in the wrong direction. So I feel like it's important within the context of this conversation to be a little bit realistic with one another. We're not going to be able to pay for all of the things that we are listing out as known needed solutions. So I think a very important factor in building the workforce here is going to be working to make sure that we use the funding we have at the levels we can staff. So instead of trying to do all things for all people, we're going to have to scale our responses to the level at which we have enough money to pay to increase the staffing, to pay them well. Minimum wage is not going to make it in mental health services. People need to be paid for the level of the job this is, which is very high technically high level, requires education and a lot of work. I will say also, as somebody who has run a big department that is sort of like 24/7, works, sort of in these difficult spaces, we're going to need to be able to pay that we spell people. Folks can't go 24/7 all the time working these difficult burnout jobs. We need to be able to have them be able to step back and do other things and be respited themselves.
Thank you both. We know that youth in King County and around the country are facing significant mental health challenges. How do you plan to support youth and their families in accessing the care that they need? And Claudia, you are up first on this
Thank
one.
you. This question is very close to my heart. As I said earlier, my family has a teenager who, like all the kids that age and in that cohort, went through something completely new and very, very challenging during COVID times at a critical time in their development, their mental health development, their socialization. And so many young people came out of that needing mental health supports. It said we all have mental health, and sometimes we need mental health care. A lot of our young people require mental health care now, and it's not all due to COVID, but COVID certainly made it far more acute. And we, as a family, with resources, with insurance, went through the process of trying to find a counselor for our young person. It's very, very hard to do. If you're a family in crisis, I imagine it is incredibly stressful to try to find care for your child. And if you don't have the resources and you're trying to work through benefits and all the associated paperwork, very difficult. I believe, again, we need to support the organizations and the people that are providing these services. We need to support places like Youth Eastside Services, like the Youth and Family Counseling organizations throughout King County. We need to make sure that as government, we are providing adequate supports to them to provide more counselors so that they are there for the young people who need them. And that means prioritizing our funding. One thing I will do as King County executive is I will take out our as yet unallocated mental illness and drug dependency fund, and we got to take a look at what the needs are today versus where we've been putting funding. That is an 18-year-old levy. We didn't know what fentanyl was 18 years ago. I didn't. And certainly the challenges have evolved since then. So should where we put our resources that we do have should evolve to meet the needs of today. And I would do that with regard to youth counseling as well.
I'm the founder of several youth-focused initiatives like the Rising Leaders, which is my nonprofit to provide mentorship to 7th and 8th grade students, like Build the Bench, which is my initiative to train young people in advocacy and running for office, like the Youth Achievement Center to provide housing for unhoused youth. I bring those up because I've engaged with thousands of youth over the past few years, and I can tell you safely, no topic comes up more than youth mental health in their view, out of all the issues that they're facing, and they're facing many. And so making sure that we have enough places for youth to go to get the care they need to make a recovery is critical. And that's why I was proud to champion having at least one of our crisis care centers be youth focused. Youth focused crisis care center so that any young person can walk in 24/7 and get the urgent care that they need to make a recovery during the peak of their crises. I was also proud to support sending $5 million for public school partnerships for things like suicide prevention that is school-based through our mid fund. Over and over again, I had made sure to prioritize young people, and we need to keep doing that. We need to deliver that youth-focused crisis care center that has not happened yet. We need to continue investing in school-based services like the one that we did through MID, and King County Public Health continues to have public health professionals in public schools. I would continue to invest in that. We need to make sure that youth are partners in designing these things, because people who are impacted by our services should be the ones co-designing it. So having a youth council to help us shape these services is critical. I also think we need to go upstream. Young people are facing these issues at a rising rate for a reason. There's something going on. We need to make sure that young people know that they are empowered to create change in their neighborhood, and they have all the things they need to live a healthy life, whether that's housing or jobs or mental health services.
Thank you. I want to turn now to a few questions that our audience members have submitted. The first of those, will you work to reduce encounters between those in mental health crisis and law enforcement, such as by hiring more dedicated crisis responders? And Gurmai, you can go ahead and go first.
Yes, absolutely. This has been a top priority for me. A big part of the Crisis Care Centers initiative is to invest in more mobile crisis responders. And so having those resources for people to, first and foremost, you have a phone number to call, so you can have behavioral health counselors help you over the phone, or you have a mobile crisis responder come out to treat you on site and provide stabilizing care in that way. And if that doesn't work, you have somewhere to go to be taken at a crisis care center to get you the services that you need there. My goal is for whatever emergency you're experiencing on the ground to have the response system that is tailored specifically to your situation. At King County, we also have a co-response system through our sheriff's office where mental health professionals accompany a sheriff's deputy. And I would want to make sure that those sheriff's deputies are training to be there as a backup and as a help, maybe standing at a distance or in their car only if they are absolutely necessary. But it's the mental health professional that is making the first contact and easing people and providing them the care that they need to make that kind of recovery. So investing in a full comprehensive suite of options when you're calling for help, whether it's 911 or 988, the appropriate person responds to you. That is absolutely a top priority for me, because we know that somebody with a badge and a gun might not always be the right response system. And there are racial disproportionalities for how people get treated and what kind of fear that they have when interacting with law enforcement. So building out that full comprehensive suite of response systems is absolutely a top priority for me.
Yeah, thank you. I think the what's called the sort of alternative response model that has been developing as a best practice is very, very promising. To respond to a crisis with the appropriate level of help is very meaningful and effective when it's done right. This question brings up a topic that I hope the listeners are aware of, and that is King County has a lot of big dreams and a lot of great values, like expanding the alternative response community officers. We are very slow to implement. The cities have really led the way on this. The city of Seattle and other cities in King County have been well down the road to implementing these kinds of services, while King County has just approved and started to ramp ours up. Since we're talking about emergency response, we still have not fully implemented body-worn cameras, well behind cities in doing this. We have a levy to improve and expand Harborview and services at Harborview, including a behavioral health center. That was voted on 5 years ago. We have not turned a single shovel of dirt to start to build those projects. One of the challenges of the next executive, perhaps the challenge, is going to be to implement, to take these visions, these values, these important initiatives, and make them happen. The crisis care centers, again, the cities led the way. I was proud to join with some of my colleagues on the council. I was the swing vote, in fact, to put some of our county funding into the first ever crisis care center, which opened in Kirkland. and is it is a partnership of the cities north of Lake Washington. And we now have joined because we have funding through our crisis care center levy, but we didn't create that, the cities did. The county could be so much more effective and put our money to better use because time is money. When you move slowly, costs go up. So I think that yes, to doing this, we are all in favor of doing these things, and especially this alternative response model. We need to be effective and move faster.
You both. Another question from an audience member. Mental health care and addiction support have traditionally been siloed. How would you plan to implement better coordination of and integration of these two support systems to treat the whole person? And Claudia, you can go first.
Thank you so much for that question. I believe that integration and coordination like this is a key step in our evolution to meet the crisis and challenge in funding that we're about to experience with federal cuts. As I talked about the example of coordinating the mobile crisis care units back, and this goes back a little ways, and I am not the expert at this, but the funding streams for medical care, behavioral health, and mental health care are very complex and very multiplicitous between the private insurance sector, the healthcare authority at the state, our role as county public health. And we were successful in putting together a county integrated care network around mental health that helps, and we're the only one in the state that does this. It helps to make it easier for the public to access mental health care because we sort of do the reimbursements behind the scenes. More of that, more systemic braiding of funding so that when you are in need, when your family is in need, you just go find your care and you submit your bills, and how they get paid is kind of behind the screen. That should be the back end, not the thing that family members need to navigate and re-navigate. So I think that kind of systemic change, working with private sector partners, the state insurance commissioner, who is a big part of all of this, that is how I think we make it easier for people. But let me just say, like many things, when we're asked a big question with, 120 seconds to answer, easy to say, very difficult to do. There's a lot of legal and financial things to navigate when you say that, but I think that's the path forward.
This is the number one topic for me. Like I mentioned before, my top priority is to break the cycle. There's a cycle of people who are facing things like homelessness, mental health issues, addiction issues, incarceration, and there's a Venn diagram. Those things are not, everybody who's facing those things is not facing all of those things, but there are people who face those things in overlap, like you're talking about mental health and addiction issues. And the response that I've gotten from people on the ground working on these issues is that the system is too fragmented and people are not working closely enough together. I would want to make sure that we're promoting close coordination and collaboration. There's an effort right now happening with people who are working in Pioneer Square to address homelessness and addiction and mental health issues and how they overlap. And what they're doing is getting in a room, mapping out the assets, all of the different systems that respond to this issue, and making sure all of those people in those systems are in the same room, meeting each other, exchanging phone numbers, understanding how somebody who is in their care goes from their care to the next person's care. I would want to make sure that that is a group that is meeting regularly until all these systems are fully integrated. And once everybody in that system knows each other, there has to be one point of entry where people are not getting turned around. If you call 988 or you call 911 or whatever it might be, you're not being turned away because you've called the wrong system for the wrong type of care. But there is a full integration of all of those services. One point of entry, you go through a system, full continuum of care, warm handoff to warm handoff to warm handoff. And of course, you have to make sure that we're identifying the silos of the funding streams and how people are restricted to provide care. That is a complicated legal question, and it's one that deserves our attention and work.
Thank you both. We only have about 5 minutes left here, so we are now going to move into each candidate has time to give a 2-minute closing statement, summarizing their thoughts and adding anything else that they want to mention. Gurmai, you can go first.
I just want to thank you all so much again. Thank you, Seattle Times. Thank you to the League of Women Voters. Thank you, Taylor. Thank you, Brittany. I know you're back there somewhere and you helped organize this. We appreciate you and all the work that you continue to do in this space. Again, we have seen the scale of the challenges before us. Sometimes we're talking about housing crisis. Sometimes we're talking about the assault on our communities by the federal government. Right now, we've been talking about the behavioral health crisis, and that is one of the many overlapping issues that we all face. And there is no individual and no level of government that's going to be able to tackle the scale of these issues on their own. Our fates depend on collective action. I think you probably saw that as a theme in all of my remarks, talking about coordination across all of the systems. But we really need coordination across all levels of government, the private sector, the nonprofit sector. That our need to work together has never been more important. And when I think about what I bring to this race, in addition to my track record and in addition to my vision, it's the relationships and the coalition that I'm bringing together, the biggest coalition in county history ready to solve problems. If the county has to work with the state to solve problems, we have the endorsement of the governor, the attorney general, more state level elected officials than any other candidate. If King County has to work with our federal delegation in order to combat the impacts of this Trump administration, our campaign is the only one endorsed by any members of Congress in King County. Both Pramila Jayapal and Adam Smith are part of our coalition. If the King County executive has to work in collaboration with the King County Council, which has the budget authority and so has such a strong say on our policy agenda, I'm the only candidate endorsed by any current or former King County Council members. And I can go down the list and show you all of the people that are ready to move forward to solve problems together. I'm asking for your support. I'm asking you for your vote. If we work together, we can solve these problems together. Thank you so much.
Thank you. And Claudia, you can go ahead.
Yes, let me reiterate and add my thanks as well. These discussions are so important. And regardless of what happens in November, we're all better off for having had them. It's been meaningful to me. I want to say right at the top, I have a website, claudiabalducci.com. There were questions we didn't get to. Please feel free to send them, and we will respond to anyone who writes in with their questions. The next county executive on this topic, as on many others, in my view, has to do three major things. First, they have to manage well. An 18,000 employee, $10 billion a year government needs to be managed to deliver the services that people rely on from us effectively and well. We need to move faster when we are making changes. People need us to make change happen now, and we are taking too long to drive the changes that we all know we need to make. And then we're going to need to evolve. We can't do business the way we've always done business, and even big new initiatives are band-aids. We need the band-aids. Band-aids are important, but we need to fix the systems. We need to make our systems work better together so there is that one door for people to go through and it's not too difficult for people to maintain their care and all the other needs that we talked about. The executive of this county needs to see management making change happen faster and making systemic change from concept through implementation. I'm the only candidate in this race who has that kind of experience. I've run a major department. I'm the only candidate with executive experience. I'm the only candidate with experience driving major change from concept through implementation, like permanent supportive housing, like homelessness shelters, like jail reform, which I led when I was at the King County Department of Adult and Juvenile Detention. I have endorsements. I am so proud of being endorsed by many mayors, people on the ground, law enforcement leaders, leaders in health, housing, and human services, because they know what it takes to make this county run. And I will work my hardest to do so as your next county executive. Thank you so much.
Thank you so much to both of the candidates for being part of this forum. Thank you to our audience and everyone who's joining or is watching this. And thank you to the League of Women Voters for co-organizing this forum with us. You can read more of our Seattle Times mental health coverage at st.news/mental health. And you can also always email our team story ideas or feedback at mentalhealth@seattletimes.com. I will now turn it back over to Evelyn at the League of Women Voters.
So I would just like to take this opportunity to add my thanks on behalf of the League to the panelists, to our moderator, and to the audience for making this such an interesting and informative discussion. This forum has been recorded. It would be available for you to see again or refer your friends, family to see on the League's website. Also, this is just one of a number of forums that the League is doing throughout the county for a lot of different positions. You can look at our website for the schedule of those other forums and also recordings of those forums. So once again, the website is lwvskc.org. So thank you very much. Thanks to everyone. And have a good evening.